Hey everybody, Dr. Mike Ma here, Real Mental Health. Now, we have a special treat. We have a subspecialized child and adolescent trained psychiatrist, Dr. Meghan Jain, who also happens to be an expert with herbs and supplements and did a 4-year apprenticeship in herbs and their medicinal uses. Now, I get questions about this all the time. Hey, doc, I don't want to start a pharmaceutical. Hey, doc, what sort of herbs and supplements should I be taking for this, that, or the other? Now, Dr. Jain, welcome. So,
Thank you.
A couple minutes or a couple sentences on your background, specifically with like herbs and supplements. And then I'll ask you as far as like what your recommendations are broadly for everybody that walks into your practice. And then as far as like targeted for depressive symptoms, anxiety, OCD, trichotillomania, skin picking, maybe. So what's your experience in training with herbs and herbal medicine?
So specifically with herbs, I completed a 4-year fellowship, or it's not really a medical fellowship. It was through an herbal program where I learned all about herbs and their medicinal uses, just in general.
Which is fascinating because she's a classically trained psychiatrist, Western medicine, but also has this like breadth of knowledge and training. 4 years in herbal medicine. Where did you get that training?
It's through the Gaia School of Herbal Education.
Where is that?
It's in Los Angeles. It's run by Marisha Mirnowska.
Fascinating. What led you to be interested in this?
I've always been interested in herbs. I'm Indian, and I grew up with my mom peddling herbal treatments for everything. And, just take this potion. It'll help you.
Oh my God, I love it.
And we learned some Indian herbs, some Chinese herbs, but also a lot of Western herbs as well. Every culture all over the world has herbal treatments that have been around for thousands of years. And in fact, a lot of our pharmaceuticals, I think about 25% of them are directly derived from these herbs.
Fascinating. Now, are there anyone you want to start off with that are just like broadly helpful before we get to like specific herbs for specific indications?
Well, there's so many herbs. There's so many good ones. It's hard to...
Let me switch it up for a second.
Sure.
Let me start by asking, what do you take? What sort of herbs and supplements are in your daily regimen?
So I would actually put supplements in a different category
Got
than
it.
herbs. Herbs are complex because we've evolved along with herbs.
Yes.
We've grown them for millennia and we've used them medicinally, and they're almost made in a way through evolution over centuries, have been designed to treat specific conditions. And a lot of our cooking herbs are great herbs. Rosemary, for example, thyme, those are great herbs. I'm not going to go that much into herbs. I think today we'll do supplements and then I will talk about herbs maybe in a future.
Yeah, and audience, if you guys want Dr. Jain to come back and we'll do a prolonged podcast on herbs, leave comments down below, but lead the dance. So what should we start off with talking about?
Something important to understand is that our food supply has really changed in the last 80 years. So if you look at an orange that was grown in 1940, that orange had 7 times the amount of vitamin C content that it does now, even if you buy organic. Although organic tends to have more nutrients. And this has a lot to do with our modern day farming practices. We have monocrop culture, so the soil gets depleted of certain nutrients. Our topsoil isn't always in the best condition. And so even if you eat a healthy diet, which of course most people are not eating the ideal diet, but even if you did, you might not be getting enough nutrition the way that your grandparents or great-grandparents did.
Okay, so what are some very popular ones that you recommend often as far as supplements?
So in terms of integrative psychiatry, and if somebody comes to me for the first time and I'm interviewing them and treating them for a mental health condition, I always look at vitamin D levels. The studies really vary on how much of the population is deficient, but it's anywhere to 50 to 90% of the population is deficient in vitamin D. Vitamin D is so important because it is an important hormone that regulates the synthesis of serotonin, norepinephrine, and dopamine. And so vitamin D is crucial. I usually ask for labs where we can test the vitamin D levels, and almost always it's deficient. It's not even about not getting enough sunlight. It's also we're not getting enough through our food, and it's usually something that is low for most people. So I usually recommend vitamin D 2,000 international units daily to start off with. If someone's very deficient based on their labs, I might increase that dose. So that is a very important supplement, vitamin D.
And it's implicated in the production and synthesis of your monoamines, your serotonin, your dopamine, your norepinephrine, which the audience will recognize as the neurotransmitters that most of our antidepressants are working on, which is why routinely psychiatrists will check vitamin D levels when there is a mood or anxiety or some sort of psychiatric complaint. So you draw a lab if they're deficient, which is what, usually like 30 or lower on the labs. You'll start 2,000 plus or minus depending on what their labs are.
Yeah. I think it's pretty, that 30 might be the cutoff, but I think they're still debating what's the right level.
Yeah.
So some people are even saying it should be 50 or 60 or 80. We don't know what the right level is, but below 30 is very low.
Definitely. Vitamin D, what else?
Another really important deficiency that's often missed is magnesium deficiency.
Really?
Which is about 80% of the population. And magnesium is really important for sleep and mood regulation. So I often will, if someone's having sleeping problems or depression symptoms, mood symptoms, I'll often recommend magnesium. I usually recommend magnesium glycinate. There's different formulations of magnesium. Magnesium citrate is more for constipation, so maybe
more active in your gut and can cause constipation.
Or it helps with constipation.
Yeah, right, exactly.
So MG must go.
Yeah, exactly. Must go.
So it helps with that, magnesium citrate, but you want to get
laxative.
Magnesium.
Yeah.
You want to get magnesium glycinate. That's more for your brain health. And typically I'd say 200 to 400 milligrams daily. Of course, you'd want to check with your primary care doctor, pediatrician before you start that. But that can be really helpful. You take it at bedtime. It can help with sleep. And there's a lot of supplements on the market, sleep type of supplements. I don't know if you've heard of Calm before.
I have.
Yeah, that has magnesium in it. So it's a really good medication to assist with sleep. Or not medication, supplement.
Yeah. So what else? What other supplements?
Fish oil.
Fish oil, omega-3s.
Omega-3 fatty acids. So
it's important, sorry to cut you off, that you pick the right one as far as EPA, DHA. So yes. I hope you'll tell the audience a little bit about that.
Definitely. So for brain health specifically, you want to pick a higher EPA to DHA ratio. I think it's going to be a different ratio if you're using it for heart conditions or heart health. But for brain specifically, a higher EPA to DHA ratio. And Nordic Naturals is a good brand. People often ask what fish oil I could use, which brand. You can use any brand. You just want to do some research and make sure it's a good brand.
How is fish oil implicated in your mental health?
So it's especially useful for ADHD. They've done some meta-analysis studies and it's shown to be 40% effective for ADHD symptoms. And just for comparison, stimulants are 80% effective. So it's a huge amount, 40%.
Absolutely. If you have ADHD or some sort of attention and concentration deficit, and you want to steer away from pharmaceuticals, including stimulants that have their own risks, although can be very effective, perhaps fish oil, EPA, favored over the DHA, is a great place to start. Meta-analyses, there's evidence that dosing appropriately with omega-3s can help relieve some symptoms of ADHD. Dr. Jain gave a brand recommendation. If anybody wants us to link specific brands of these supplements, leave comments down below. We're happy to do that.
Yeah, I don't have any affiliations with brands or anything like that. But I will get asked about brands. I really like Pure Encapsulations, and I like Thorne, and Nordic Naturals for the fish oil specifically.
Yeah, I'm a Thorne fan as well. What other supplements are you a fan of?
Iron, I think it's really important, especially in young women, both girls and young adults but everybody to get tested in iron. A lot of symptoms of iron deficiency can mimic psychiatric conditions. So it can cause irritability, depressed mood, fatigue, low energy, trouble sleeping at night, restless legs. So definitely want to get that tested. That does require the blood test because iron supplements have their own risks. It can cause constipation. So you want to take the appropriate dose. So that's something to go to the primary care doctor for, or your psychiatrist. I will say you can't just do a CBC, which is a typical lab that pediatricians will order to test your hemoglobin. That might not be enough information. You want to do the full iron panel. And if you talk to your doctor, they'll understand what that means.
Yeah.
Because sometimes your iron stores can be low.
Fascinating. And low iron, one of the things it can cause is anemia that might show up on the CBC, the blood count. And if you're anemic, we need to get to that first. Part of being a psychiatrist is that we look holistically at also the medical health, your physical health. If someone is anemic and they're complaining about fatigue, restless leg, depressed mood, the first thing you got to rule out is any sort of like vitamin deficiency or iron deficiency, anemia. So it's so important that you have these routine lab tests. And again, CBC is not always enough. Sometimes you need an iron panel to make sure that, hey, maybe we just have to correct some sort of like metabolic hormonal vitamin deficiency before we jump to prescribing antidepressants.
Exactly.
What other supplements are you a fan of?
Getting more into specific conditions, sometimes zinc can be helpful for depression. There have been several studies about that. I'm hesitant to prescribe zinc right off the bat because it can cause stomach upset. So, that one I would really talk to your doctor about before you start, but that can be really helpful. And the last one I wanted to mention was for trichotillomania or excoriation. Basically what that means is skin picking or hair pulling. So that could be on your head, your eyebrows, your eyelashes, just pulling. Sometimes that gets worse under stress, or if you're just doing it absent-mindedly. NAC or N-acetylcholine has been found to be very helpful with that. The studies show 600 milligrams twice a day is the dose that can help with that.
And
condition.
NAC, I mean, if you look up the evidence, if someone comes to me with an excoriation disorder, skin picking, trichotillomania, if you look at the evidence, the first line treatment is actually NAC rather than any sort of pharmaceutical.
Right.
So you do even have like this Western medicine, evidence-based literature that will recommend supplements first line over pharmaceuticals, which is fascinating. 600 twice a day. Sometimes we'll bump it up even further than that.
Right.
But that's definitely a place to start, and it's usually well tolerated.
Yes, definitely. And, a lot of other supplements have evidence. So another thing I'll mention is there is a gene mutation. It's called MTHFR. You can do either a genetic test or a blood test to see if you have this mutation. It's relatively common. So even if you have enough folate in your diet or you consume enough folate, the enzyme that converts the dietary folate to the version of the folate that your body actually uses is slower or compromised. So you might not have enough folate to actually use in different chemical reactions in your body. And folate is another important molecule that's used in the synthesis of all these neurotransmitters like serotonin, norepinephrine, and dopamine. So it's important if you're not really responding well to an antidepressant or you're not seeing much improvement to get testing for that enzyme deficiency, because if you have that, there is a supplement. It's called L-Methylfolate. You can even buy it on Amazon that can bypass that enzyme, and so you have enough folate. And I've seen miracle turnarounds with that. I mean, it's really important for the individual who does have that.
Yeah, MTHFR. Now, I just recently had a case. And so we need this active form of folate for all sorts of reasons. Dr. Jain was saying one of the most important ones is synthesis of your monoamines, your serotonin, norepinephrine, your dopamine. And as part of like the genetic testing that I will do routinely, not just to check the like enzymes and how fast you're metabolizing medications, but that MTHFR genotype, some people are deficient in forming this active folate, and supplementing with L-methylfolate, usually start at 7.5, 15 milligrams is the best evidence-based dose, can produce amazing results.
Really?
Now, I'm going to leave, we actually have an Instagram post coming up on this. A lot of these L-methylfolate supplements, it'll say 15 milligrams on the bottle, but if you look at the back, it's like 12.5 of dietary this, which equals actually just 7.5 of the active L5-methylfolate, like it's citrate, whatever sort of like compound it is. So make sure you're taking 15 milligrams of the active L-methylfolate, which is the best evidence-based dose, and not just 7.5. And just because it says 15 milligrams on the front of the label does not mean you're actually getting the 15 milligrams. So look at the back, everybody. And again, I'll be leaving a social media post about this shortly.
And just one more thing, if you're gonna take L-methylfolate, if you have that mutation, you also want to take a B12 vitamin complex.
Exactly. You want to have further labs drawn. You want to test your homocysteine. You want to draw levels for your B6, B12. I'm going to ask you about B vitamins in a moment. We're not going to get too nitty gritty with this. If you guys are curious, you guys can ask in the comments. Maybe we will. Point being, it's not just enough to take the L-methylfolate. You also want to get tested, see what your B vitamins are, so on and so forth. On that topic, B vitamins, B6, B12, tell us about B vitamins. What do we need to know?
B vitamins can be very helpful for the right individual. Some people do have deficiencies in those vitamins, so I think it's always worth trying because it can have a really dramatic effect for the right person. Mm-hmm. I don't see that deficiency quite as commonly as some of the other ones I've mentioned, such as magnesium, which is like, 80 to 90% of the population, and vitamin D, but it is quite common. So especially if you have that mutation, and even if you don't, that might be worth looking into.
Yeah. Now, I know you said that like with today's like farming practices, a lot of the foods that we have don't have as much nutrition as they used to have. But what are some superfoods? What are some foods that are high in magnesium, high in vitamin D, high in folate? What are some superfoods you recommend incorporating into your diet to avoid some of these vitamin deficiencies?
Dark leafy greens have a lot of iron and magnesium. Chocolate has dark chocolate, not the Hershey's kind. Not that there's anything wrong with Hershey's, but if you're trying to go for
there's
the
everything
vitamins,
right with Hershey's. Thank you.
if you're trying to go for the most high magnesium content, you want to do like a dark cacao kind of chocolate. And then that is helpful for sleep too. Although chocolate has caffeine, so be careful. But with other foods, it's mainly just plants. Plants have so many nutritious hormones and vitamin K, just general vitamin content. So
Yeah. Plant-based diet, Mediterranean diet, whole foods, stay away from anything processed or refined.
Fish, sardines, anchovies have a lot of omega-3s. But I will say it is sort of hard to eat enough of those fatty fish to get the requirements that we need just because of the farming practices that we have.
Exactly. Any other must-hit vitamins or supplements that you want to present before we conclude today's video?
There's so many, but those are the main ones. I honestly, when I first see someone for the first time, I try to do a couple because it can be overwhelming because, I'm already recommending if they're seeing me, I'm possibly already recommending a medication, and then I'll pick the two most important and then add on from there. I think it is helpful to do one at a time just to make sure that it's really helping, because it is a big ask to ask somebody to take a vitamin consistently. So you want to make sure it's, the most bang for their buck.
Absolutely, especially those big fish oil capsules that when you burp up later, it's so disgusting. So if you're going to be enduring that, we better make sure that it's worth it and it's helping.
Exactly. I know what it's like. I mean, I have a hard time taking vitamins myself. I have a vitamin D bottle that I take occasionally, and I know I need more. So I'm not under any pretenses that this is easy to just add all of this on. I think it's best to do the most effective and work your way up from there.
Absolutely. My favorites are the magnesium before bed and the fish oil. If I had to recommend two, I take both myself. Okay.
And vitamin D for me. So.
And vitamin D.
Yeah.
Now, Dr. Meghan Jain, Ocean-Based Psychiatry, child and adolescent psychiatrist, also an expert in herbal medicine. You guys can catch a full-length podcast on my YouTube, Real Mental Health with Dr. Mike Ma. And if you guys have any further questions or want to bring Dr. Jain back on to talk all about herbs and maybe supplements, but she's an herbal specialist, leave comments below. Dr. Jain, thank you very much for coming on.
Thanks for having me.
Okay.